Good morning, everyone. It's 1 o'clock, or sorry, not good morning, good afternoon, everyone. It's 1 o'clock. We'll get started. Um, just want to start by saying hopefully everyone's well and safe and navigating safely through these uncertain and unprecedented times. So I'm Clint Fraser. I'm the CEO of the Northern BC Tourism Association. I'd like to acknowledge that today I'm speaking from the traditional unceded territory of the Lheidli T'enneh people here at our office in Prince George, BC. Certainly appreciate you taking the time today and welcome you to today's webinar, WorkSafeBC Health and Safety Guidelines. This is the third province-wide webinar we've offered through the BC Tourism Resiliency Program, and I see we have some good representation of businesses logging in from across BC today to take part, so we're excited about that. I'd also like to acknowledge and thank our partners who have been instrumental in assisting us in putting the BC Tourism Resiliency Program in place, and obviously without whom this program wouldn't be possible. So there's a number of partners that I just want to call out here for a second. The Ministry of Tourism, Arts and Culture, Indigenous Tourism BC, Island Coastal Economic Trust, Chemistry Consulting, and of course, the BC Regional Tourism Secretariat, consisting of the 5 regional destination management organizations. Many of you will otherwise know these organizations as the Cariboo-Chakotay Coast Tourism Association, Thompson Okanagan Tourism Association, Kootenay Rockies Tourism Association, Tourism Association of Vancouver Island, Northern BC Tourism Association, and of course, Destination BC, who represents the Vancouver Coast and Mountains region in this program. So a lot of associations there. That was fun to navigate through. Just a couple of quick housekeeping items before we get started here. The first one being, you might see a picture of a beautiful woman in a hood. That's Hannah Graham from Tourism Vancouver Island, who's helping us on the tech side today. So I just want to call that out if you're wondering who that is. And we're aiming for this afternoon's webinar to be approximately 60 minutes in length, and it will be recorded. So if you're taking notes and miss something, you can always reference back to the recorded version, which I think will be posted along with all of our other webinars to the BC Tourism Resiliency Program website by Monday. And for those of you that don't know, that website can be located at www.tourismresiliency.ca. You'll also notice that there is a Q&A function at the bottom of your screen that you can use to submit any questions you might have during the webinar. And we certainly encourage you to engage and use that. Also wanted now to introduce, make an introduction here. It's my pleasure to introduce this afternoon's presenter on this much anticipated topic. We're joined today by Chris Back from WorkSafeBC. Chris is the Director of OHS Consultation and Education Services at WorkSafeBC. Consultation and Education Services serves the workers and employers of BC by positively influencing health and safety behaviors, disability management practices through partnerships, consultation, and outreach. Chris has been with WorkSafeBC for 6 years now, and before moving into the director role, Chris managed the manufacturing and retail portfolio as well as construction portfolio in consultation and education services. Prior to WorkSafeBC, he held various leadership positions in health and safety and disability management, primarily in the healthcare industry. And Chris is a Canadian certified professional ergonomist and holds an MBA from Royal Roads. So with that, I think we're in excellent hands today and would like to welcome Chris.
Well, thank you very much, Clint. Very much appreciated. A great intro. What I'm going to do here, everyone, is I'll just, as I'm talking, bring up my screen and bring up the home page here, and hopefully everyone's able to see that. As Clint mentioned, Hannah can help out with any technical issues if you're having those. Hopefully everyone can hear me clearly. And thanks for inviting me and having me here today to be able to present to you on a very hot topic. I think this is probably around the 30th 25 to 30 or so now over the last month of these webinars that we've run, or that I've run, let alone all the other ones that our organization has been putting on. So I do want to thank you for having me here today. And really what I'm going to do is I'm going to focus in on the primary piece being the development of a COVID safety plan, which is now a requirement for all employers in the province. But before I get there, what I am going to get into is a little bit of an understanding and signs and symptoms and things like that. But once I've done that, we'll really get into the details. How do you develop your plan? We've put together a process, a 6-step process that will help in on controlling the risk of exposure in the workplace. I'll then give you tourism over the course of the next number of weeks, talk about some other resources that are available to you through WorkSafeBC, as well as through some other organizations, and then we'll open it up for Q&A, which I understand that Clint is going to help to navigate for us. So it should take me about 15 to 20 minutes of Q&A after that. So let's start off with a bit of a high-level understanding of COVID. And again, most people are fairly familiar with this, and I'm not going to go through the details on the screen, but I do want to point out a couple things. The first being the bullet down in the bottom left-hand corner, which talks about the symptoms and the range of symptoms being mild to severe, but more importantly, that those symptoms can appear up to 14 days after exposure. And this is where it becomes challenging in how we control for this particular disease, because we don't necessarily recognize the symptoms for up to 14 days. So workers or the general public can be transmitting the disease without showing any signs or symptoms. So, you know, we hear a lot in the news about whether or not employers should have thermometer checks before, before the workers or public are coming into the work site. That can possibly measures you put in place, but if you consider that the signs and symptoms of the disease may not manifest for 14 days, then that won't be the only control measure you should have in place, because it's not going to be effective for those that may be transmitting the disease. So we need to look at other things such as hand hygiene and cleaning and disinfecting and physical distancing, which we'll get into quite a bit today. And really, when we get into transmission, this is it's important to understand within the transmission risk factors that there are a number of things that can increase the likelihood of transmission. And I'll go through these. The first one really being challenges in maintaining the 2 meters of distance. And that's why a lot of what we hear from the provincial health office and from the government as you saw on the prior slide, because we're at droplet transmission, basically when those droplets come out of your mouth or your nose, they drop to the ground typically within about a 6-foot radius. And so that's why if you can maintain a 2 meter distance from other people, then that is one of the most effective ways in controlling for the risk. So if you have challenges within your workplace of having workers maintain 2 meters with certain tasks between other workers or with the public, that can absolutely increase the likelihood of transmission. So I'll talk about how you should really consider the control measure side of that, and the impact of not maintaining that 2 meters and what you can put in place in order to minimize any transmission if that is the case. High frequency of unique people in the workplace. And what I mean by unique people is just different people. So if you're in an office setting where you don't have public coming in during the day, then really it's only those people that are working within that office setting that may be a restaurant or a retail association, or in this case, many of you are in tourism, you've got the general public coming in on a regular basis. And so you're getting a lot of different people coming into the workplace and potentially increasing the likelihood of transmission. The potential to work in enclosed areas. So as we've heard a lot, outside is better than inside, and when you're inside, bigger space is better than smaller space. So something to keep in mind, and in a lot of cases, with tourism, a lot of it might be outdoors, which is great. but do control the size of the space, but you might be able to control the layout of the space. And we'll get into some details on that as well.
Hey,
Potential
Chris.
for sustaining group interaction. So the longer you have a group of people together, the more chance there is for transmission. The probability of infected persons. So again, in a setting like healthcare, where there's a higher probability of having infected people, that obviously increases the likelihood of transmission. And then inadequate self-isolation practices. And we'll talk about that when we get into policies and procedures that you should have within your plan. The last one there under surface contact, and we'll talk more about this too, but surfaces absolutely do increase the likelihood of transmission, but we want to focus mostly on those surfaces that are touched fairly regularly throughout the day. And as I said, we'll talk more about that as we move on.
Hey, Chris, it's Clint here. Just wondering, it seems like we're having some audio issues. It's cutting in and out. I'm not sure if there's any adjustments you can make on your end, or if we're just sort of, if there's anything we can do on your end.
Yeah, well, let me see what I can do here. My apologies.
Yeah, it's just intermittently cutting out.
Show input level. I'll put the input level up a little bit, see if that helps, and we'll go from there. So yeah, my apologies. Jump in, Clint, and let me know if it continues. Appropriately. It might also be that other people in my family are using some of the bandwidth in my house, so I could possibly go and ask them to cut down on that. But jump in again, let me know if we still get it cutting out, and I'll see what we can do. My apologies.
Thank you. Yeah, it's cutting out fairly frequently, so yeah, we'll monitor it here.
Okay. So when we talk about, I'll just keep going then. When we talk about the signs and symptoms, really what we're talking about here is that if any of your workers are experiencing signs and symptoms, then they should be letting their supervisor know immediately, physically distancing from colleagues and leaving the workplace, and then seeking medical advice from healthcare professionals. So of course 911 if it's urgent, but probably more likely 811 to get that health advice and possibly get tested if those signs and symptoms continue. And then consulting with the healthcare provider before returning to work is really important as well, and ensuring that you have that clearance to come back to work, particularly if you did have a positive result with COVID tests. So now let's get into the bulk of this, and really when I get into when we're going to spend most of our time here, when I get into this, we're really going to focus in on the announcement that came through from the government last week. So there was an order that was written and posted on the Provincial Health Officer website on the 15th of May, and essentially that order to all employers in the province states that all employers, if they are operating, are required to have a COVID safety plan, and that safety plan needs to be posted to your workplace. Now that could be on your website, it could be on your front door, but it needs to be available to your workers, and it needs to be available to the general public that might be coming into your workplace. So a lot of employers have been asking, well, how do we actually create that safety plan? What does it need to look like? And we're going to dig into that today. And we have a template for you. You don't have to use our template. You don't have to use the WorkSafeBC template. But I will walk you through the 6 steps that we have created to help employers do this. And then we'll also talk about some of the resources we have available on our website that will dig into each of the industry-specific pieces. The one main point that I want to make here as well is that employers are not required to send their plan to WorkSafeBC for approval before they can open up their doors. It is expected that you are putting together your plan. You don't even necessarily have to have your plan finalized before you open up your doors, as long as you are, while you're developing your plan, managing the safety and putting control measures in place for your staff as best as possible. So it's really important in this situation that you understand that sending it to us, you're not going to get a review from WorkSafeBC. We don't have the capacity. There's 250,000 employers in the province. We don't have capacity to be reviewing everyone's plans. But if an officer comes out and does an inspection, and I'll talk about this a little bit later as well, if an officer comes out and does an inspection, they are going to ask to see your COVID safety plan, and it is expected that you're going to be able to produce it. And if you're still in the midst of developing it, that's okay, but you will be expected to be showing as an employer that you're going through the due diligence of putting that plan together and that you're well along the way of providing control measures to reduce the risk for your workers. Clint, maybe just a quick check-in. Am I still cutting out, or is it any better?
It's definitely seemed to have gotten better. So I don't know if the kids have jumped off line or.
Yeah, maybe. Okay, well, jump in and let me know if it cuts out. And
yeah, I will do. Thank you.
Okay, so let's actually get into the steps here. And I think really, you know, before I actually show you those 6 steps, it's really, really important that all of you understand the orders, the notices, and the guidance that are on the Provincial Health Officer website and the BC website. And if you just go onto Google and print and search Provincial Health Officer orders, it'll take you right to the page that has all the COVID orders on it. And for example, if you are in the restaurant industry, there is an order that was issued on Saturday of last week that speaks specifically to what the restaurant and food services industry needs to pay attention to. And if you are a tourism facility that also has food services within your organization, then you'll want to take a look at that order and make sure you understand the rules and requirements that have been put forward by the provincial health officer. So first and foremost, you need to understand the orders that apply to you as an employer. And then we get into developing the plan. So the basics, pretty much everything I'm going to talk about is focusing on physical distancing, cleaning and disinfecting, and personal hygiene. And we'll talk about the policies behind all of that and how we minimize the risk for your workers. And related to personal hygiene, looking at things like covering your mouth and your nose with a disposable tissue or the crease of your elbow when you sneeze or cough, washing your hands often with soap and water for at least 20 seconds. So we know that using soap and water is the single most effective way to reduce the spread of the infection. And if soap and water are not available, you can use alcohol-based hand rubs, or otherwise known as hand sanitizers. But you need to ensure that your hands are clean before you use the hand sanitizer. So soap and water will clean your hands and kill the virus at the same time. A hand sanitizer is not going to clean your hands. So if you've got dirt all over your hands, the virus could be hidden underneath that dirt. And if you're trying to clean that off or kill the virus with the hand sanitizer, you may not be doing an effective job. So you want to ensure that you're washing your hands, cleaning the dirt off your hands before you are using any hand sanitizer. Avoid touching your face as much as possible, including your eyes, your nose, your mouth with any unwashed hands. It's amazing how often we do touch our face during the day, and a lot of times you're doing it unconsciously and not really paying attention. So something to try and be conscious of. And then not sharing any food or drink or other items like utensils or any plates or dishes or anything along those lines within your workplace. So the 6 steps, if we talk about the 6 steps, this is really high level. We're going to get into each of these 6 steps. So first step being assessing the risk, understanding where the risk might be apparent within your workplace. Then implementing control measures to reduce that risk. Step 3, developing policies to manage your workplace. So once you know what control measures you want to put in place, it's really important to have policies that are going to support those control measures, and I'll talk more about that. Developing communication plans and training. So how are you going to communicate this out to your workers and to the public and ensure that your workers are trained in any new protocols that they may need to take into account. Step 5, monitoring your workplace and updating your plans as needed. So taking that sort of plan, do, check, act approach to doing this, where regularly you are looking back at your plan and making sure it's working. And we'll get into that. And then step 6, assessing and addressing risks from resuming operations. So this is kind of outside of the scope of COVID in that if you've been shut down for 2 months and you're bringing things back on board, there's risks you may be introducing by starting up machinery or possibly training staff that have not been engaged in the workplace for 2 months. So there's other risks there that we need to make sure that you're paying attention to as well. So let's dig into each of these steps. Step 1, assessing the workplace to identify where risk transmission is introduced. So this is looking at all of the tasks, things like where do people congregate, what job tasks or processes require the workers to come into close proximity with one another, what tools or machinery or equipment do people come into contact with, And along those lines, which surfaces are touched often. Things like the light switches or door handles, things like that that are touched often are places where you want to be paying attention to some of the control measures you're going to put in place. The second bullet there is really an important one. It is around involving your frontline workers and supervisors and joint committee representatives if you have a joint committee throughout this process. And this brings me to probably one of the most important slides that I'm going to show you today, and it is involvement of your workers. So if you have 9 or fewer workers in your workplace, then you don't require a joint committee or a worker health and safety representative under the Act, but you are required to involve your workers in the conversation. If you have between 9 and 19 workers, then you are required to have a worker health and safety representative. And if you have 20 or more workers, you are required to have a joint occupational health and safety committee. It's really important at this time that you are not foregoing any of your involvement, your meetings, your regular engagement activities with these groups. Including your workers is so important through this process. We know that there is a ton of fear from workers. There's a ton of fear from the public. We've seen it all over the news. Some of you may be feeling it yourself on getting back into the workplace. Am I really going to be protected and safe coming back into the workplace? And one of the ways you can allay that fear is to involve your workers in the process of developing your plan. They do the job. They're going to know how the work is organized. They can come up with great ideas to be able to add to the plan. And I mean, in the end, it's your responsibility as the employer to make sure that plan is put in place. But involving them is going to go a long ways in your workforce, having confidence that you're paying attention to this issue as the employer, and hopefully reduce the fear that they may have in coming back into the workplace. So extremely important that you're utilizing your workers in this process. So after you're done step 1, we then get into step 2, which is once you understand what those risks are, how are you going to control for the risk? And again, most of this is focused around maintaining physical distancing. Where you can't maintain the physical distancing, what else can you look at? And then cleaning and hygiene. And that brings me to the other most important slide that I'm showing you today. And I'm going to spend a bit of time on this one. And this, in our sort of geeky safety world, is what we refer to as the hierarchy of controls. And what you'll notice over on the left-hand side of the screen is an arrow which says, consider first down to consider as needed. So what we're really wanting employers to do is focus at the top of this reverse pyramid to begin with when you're putting together your control measures. And that's eliminating the risk. And I'll go through each of these in detail. Then it goes down to engineering controls, then administrative controls, and then PPE, or personal protective equipment. And what's really interesting, just at a high level before I dig into each of these, is that personal protective equipment are things like the gloves and the non-medical masks and other things like that. And that tends to be where the public, where people, where employers, where workers want to jump to first is, are you gonna, you, the employer, are you gonna give me a mask, or are you gonna force me to wear a mask? There is a possibility that depending on the situation, wearing a mask can be an effective control measure, but it shouldn't be the only control measure. It's actually the least effective out of the categories of control measures in protecting you and your workers. You need to ensure that you're considering a combination of control measures that will be engineering in nature, administrative in nature, and will eliminate the risk. So if we look at elimination, this is really where we are focusing on the 2 meters of distancing. What I talked about earlier is that we are in droplet transmission here. So if you can maintain more than 2 meters of distance between people, you are really eliminating the risk. Maybe not completely, but for the most part, you are eliminating that risk by keeping people apart from each other. So look at ways that you can do that by rearranging the workspaces, by rescheduling work tasks, having policies and procedures in place to be able to support that, and ensure that your coworkers, your customers are all aware of how that is to be done within the workplace. But you can also look at engineering controls to help you with that process. And engineering controls are typically controls that take place right at the source of the risk. And the best example of this is installing barriers. And plexiglass barriers have been talked about a lot in the news. You've probably seen them when you've gone out to grocery stores, that you'll see a plexiglass barrier between the cashier at the grocery store and the customer. And that plexiglass barrier can create a physical barrier between you and the other person, whoever that other person is, and reduce the opportunity for that droplet transmission to move from one person to the other. Plexiglass is also very easy to clean. You don't have to use plexiglass as a barrier. There are other sources out there. As long as you have that physical barrier, then that does allow for very effective controls. So that would be sort of a category within, or an example within engineering controls. We then come down to the third level of protection, which is administrative controls. And this is where we are getting into other policies and procedures around creating occupancy limits, having policies in place around those that are coming into the workplace who might be sick and not allowing, or showing signs of symptoms and not allowing them in, sending workers home, looking at the flow of people through your work site, like again, using grocery stores as an example. Many of you have probably seen arrows up and down the aisles to try and create a flow of people and avoid the crossing of people. So having those types of policies, procedures, posters around to remind people for hand hygiene, things like that is the next level of control. Then we come down to that least level, which is PPE, or personal protective equipment. And for the most part here, we are talking about non-medical masks. WorkSafeBC is not recommending gloves really in any situation, and really for the reason that if you have gloves on your hand, those gloves are probably picking up the virus just as much, if not more, off of surfaces. And if you're still touching your face with a glove on your hand, it's not making any difference. You can't absorb the virus through your skin. It only goes in through the hands, the nose, the mouth. So if you're wearing gloves, it's really not necessarily going to be helpful. There may be other reasons you have to wear gloves for other risks. Obviously, we're not saying you shouldn't in that case, but it is not a good control measure for COVID. So really here with PPE, we're talking about the non-medical masks, which we can get into and answer questions related to if you have any of those moving forward. Now, there are situations, as we talked about, where you can't necessarily maintain that physical distancing, and traveling in vehicles is one of them. And being tourism organizations, I'm sure there's lots of travel that happens in vehicles. If you're taking people on tours or out on boats or you know, in vans to get to a certain location, I'm sure there's lots of opportunities where travel occurs. And you need to think about how that travel is going to happen in as safe of a way as possible. So we are recommending to employers that you limit essential work travel, ban non-essential travel, but where travel is required, if there's a possibility of sending workers on their own in a vehicle, that's great. But where there isn't, and I'm sure in lots of cases there isn't, you want to look at how you can physically distance people in the vehicle. So if you've got a van and you're able to spread people out in the van, you want to alternate seats, try and keep people, you know, as far apart from each other as possible. But again, if you're filling that van up and you've got no way of avoiding the 2 meters of distance, that's where you want to start considering things like masks. And again, the masks are not protecting you. If you are wearing a mask, it's not protecting you, it's protecting other people. So for this to be effective, everyone in that van would have to be wearing the mask so that their droplets are not spreading to anyone else in that van. So you need to keep that in mind when you're putting your policies and procedures together. You also want to ensure that you have good wash stations, hand hygiene, getting into the vehicle and out of the vehicle, whether it's hand sanitizer or actual soap and water wash stations. It's really important. You want to ensure that you're also cleaning high-touch surfaces within the vehicle on a regular basis, like the door handles, the seat belts, the steering wheel, the shift knobs, the windows, all that sort of stuff. So things to think about in this type of situation where you have multiple people traveling in a vehicle. We then need to think about the protocols we have in place for cleaning and hygiene. So I'm sure you all have cleaning practices within your businesses, but you really need to think about those cleaning practices and think about the frequency of those cleaning practices and how you deploy those cleaning practices, which staff are doing them, when they're doing it, all that sort of stuff. So we talk about here, we really talk here about providing adequate hand washing facilities on site for workers and ensuring that the location is visible and easily accessible. Developing policies around when workers should be washing their hands, including when they arrive to work, before and after breaks, after handling cash or other materials, before and after handling common tools or equipment that are shared, things like that. You want to ensure that supplies are available for your staff, like soap and water, hand sanitizer, disinfecting wipes, nitrile gloves or garbage bags for those that are doing a deeper clean. Implementing cleaning protocols for commonly touched surfaces, like washrooms, equipment, tools, common tables, desks, light switches, door handles, those types of things. And then removing any unnecessary tools or equipment that you don't need to have in the workplace that might be elevating the risk of transmission. Maybe you don't have coffee machines necessarily, or shared water stations, or shared utensils or plates or snack bins. Maybe you're not providing lunch as often as you would, or if you are providing lunch and that's a part of your service, maybe it shouldn't be a buffet lunch and you should look at individually wrapped sandwiches or plated lunches or something along those lines, just to minimize the transmission. And then you want to ensure that you're training your workers on these new protocols, that you have good supervision in place, and that you're documenting all of this within your plan. And then getting into step 3. So once you've come up with the control measures you want to develop, then we really get into the policies that are going to support that. And this is important because those policies are going to back you up as an employer. If you have policies in place, there is a responsibility for the workers to follow those policies. And I have a slide on that coming up. But you want to think about the policies you have in place on the cleaning, the hand hygiene, and the cleaning and disinfecting. You want to think about policies you have in place related to any of your workers who show signs and symptoms, that they should not be coming to the workplace, or if they do show signs and symptoms when they get to work, then they should be sent home. You should probably have policies in place to say that any of the public or any customers that might be coming into the workplace, if they're showing signs and symptoms, they won't be let in. And even having someone doing an initial sort of, I'll say, survey or check with those members of the public, your customers, before they either arrive at your workplace or as they do arrive at your workplace is a good thing to be doing. And just asking them simply, have you been experiencing any signs and symptoms of illness? And if so, we'd ask that you're not being here. And we actually have a policy in place and you won't be able to get our service today. And how you sort that out is going to depend on your business, but we do recommend that you consider those types of policies as you're moving forward. So you've got your plan developed, you've put your policies in place, now you need to communicate. So your communication plans and your training, ensuring that everyone in your workplace understands what they need to be doing, what their role is, what their responsibilities are, making sure they're trained and oriented to whatever the new protocols might be, posting signage that helps to support that and continue to drive the communication, and ensuring that you have really good supervision in place and your supervisors understand their responsibilities and what they need to be doing to help to support that messaging with your staff. Step 5, talked about this a little bit already. This is that plan, do, check, act approach, and just ensuring that your workers have the ability to bring any concerns they have forward, what might be working, what might not be working for them, and revisiting your plan and modifying your plan as you're moving forward. And then step 6, again, this is where, you know, you may have staff that, just as a really good example here, you may have staff that started with your organization back in January or February, you know, a month before things shut down. They got their orientation, they got their training, but now 2 months have gone by where they haven't done any of that. They may need to be reoriented or retrained in certain things. And you should think about that so that you're not introducing any other risks that you may not be thinking about right now. We recognize that COVID is front and center for everyone, but there are still a lot of risks in the workplace that can lead to serious injuries or fatalities. And it's really important that you're not turning your mind away from those risks. It's still really important that your workers are working in a safe environment from that perspective, above and beyond just what we're talking about related to COVID. So how do you do all of this? We have lots of information on our website. We've got a COVID safety plan that we've put together. You know, there's a link right here. This PDF, a PDF version of this PowerPoint will be sent out to all of you, so you'll have access to all the links on here. You can go to our website. I'll talk a bit more about our website in a bit, but you can access lots of resources there. And it can be somewhat overwhelming, but we're hoping that this templated safety plan can help walk you through these 6 steps. It is a 9-page document, but most of the pages in that document are blank space for you to actually type in your plan and use this. You don't have to use it. You may find that you just want to have a good old piece of paper that you write your bullets out on and your bullet points, your control measures out on, and communicate that out to your team, and that might work for you. But here is a template that you can use that will walk you through in a bit of a checklist format to help you through the process. So you've got your plan in place, you've posted it, you've communicated it out to your workers. Now you need to make sure that your workers also understand their responsibilities here. So workers have responsibilities under the Act and the regulation. They need to follow the policies and the instructions that you are putting in place as the employer. They need to be following the physical distancing, the cleaning and disinfecting, and the personal hygiene practices that you're putting in place. And again, if you have policies in place for those, it's going to go a long ways. But workers also have rights, and they have 3 key rights: the right to know about the hazards in the workplace, the right to participate in health and safety, and the right to refuse unsafe work. So those first 2 come around involving them in the conversation and communicating out to your workers. But that third one, around refusing unsafe work, if any worker comes forward and says, I don't believe these control measures are keeping me safe, and I have a concern that my safety is at risk, and in this particular case, contracting COVID, you are required as an employer to investigate that situation, and you need to involve the workers through that process. It's all laid out in our regulation. We have links to it on our website, and there's a number of steps that you'll go through in trying to resolve the issue. The last step being, if you're unable to resolve it, you can call us at WorkSafeBC, and we will have an officer come out and work with you and your workers to be able to resolve that issue. And I'll talk more about how you can contact us in a few slides here. We also really want workers to be minimizing their exposure outside of the workplace. It's not under your control as an employer, but we should be communicating and reminding our workers, as we are with the general public on a daily basis, to be minimizing their exposure outside of work. So industry-specific protocols. There's a ton of information on our website, and I'm gonna talk a bit about tourism here in a moment. This just gives you an outline on the screen here of all the industries that we have already developed protocols for. So phase 1, which were the essential services, we think about healthcare, some retail like grocery stores, transportation, manufacturing. Many of these industries were considered essential service and continued to operate throughout all of the last number of months as we've been going through this. And then many were ordered to shut down, some voluntarily shut down, and that's what falls under phase 2. And we developed protocols, very specific protocols for these various industries. That's all posted on our website under our phase 2 section. Now you'll notice that tourism in and of itself is not there. Tourism, we are working on it right now, and we have actually, in conversations with the government, for the most part, tourism is a part of phase 3. A lot of areas of tourism were not told to shut down. Some may have been. But really what we're looking at here is taking the various aspects of tourism and developing some protocols and some guidance so that come the beginning of June, you will be able to go onto our website and you will see a section specific for tourism. But if you're waiting, if you're kind of itching to get your plan together and you want to start working on it, you can still go to our website and you can still tap into our template. And then what I thought I would do is just outline a couple areas where I thought it might be valuable for you to look at these specific sections, because I'm sure these sections will apply to some of the operations that you have within your business. So transportation, we talked a bit about passenger vehicles. So there might be some information in our protocols for transportation that will be helpful for you. Hospitality, we've already got some stuff up on our website around hotels, kitchen workers, outdoor RV parks, restaurants and food delivery. We've got actually a specific section on restaurant now that you can look at. Small business, many of you are probably small businesses. We've got lots of information there across many industries that will help you with small business. Retail, lots of information on retail. And you notice all the bullets on there. Those are just the high level categories of how we have put our protocols and guidance together. So underneath each of those bullets, you'll see a drop down of an additional list of protocols and guidance that you can consider as you're putting your plan together. Restaurants I mentioned already. Actually, before I get to the psychological health and safety side of it, the one thing I also want to mention that the guidelines and the protocols that we have on our website are not requirements. They're not mandatory. They're not written within our regulation. You cannot be written an order from WorkSafeBC because you haven't put in one of the guidelines or one of the protocols that we have listed on our website. They are just that. They are guidelines to help you be able to develop your plan. They're not overly prescriptive because it really depends on the specificity of your business and how you need to apply those protocols and those guidelines to your working environment. So it is meant to be a guide for you. We can write orders, and I'll get to that in a moment, but we're not going to write an order if you have not implemented a specific bullet point that we have within our guidelines. So keep that in mind. They're meant to be useful for you to put together your plan. So we get a lot of questions, and two areas where we get a lot of questions are around psychological health and safety and working from home. So the mental health side of things, we recognize here that everyone in everything that we do in every walk of our lives, COVID has impacted it. And this impacts people in different ways. And the unfortunate part is some people are exposed, predisposed potentially to higher levels of anxiety or stress, other mental health issues, and this could be triggering, probably is triggering many people from a mental health perspective. And it's really important for you as an employer to understand that you need to be focusing just as much on physical health, you need to be focusing on mental health and the mental health of your workers. And so we have some links here that will take you to some websites that have some great information, some toolbox talks, some tips, some posters you can put up, some pre-recorded webinars that you can share with your staff, focused on mental health as we are going through this pandemic. There's a lot of uncertainty here. People don't know what the future is going to look like. And it's really important that you are doing the best you can to support your workers. And again, I go back to talking about involving your workers in developing the plan and allaying and minimizing some of those fears they may have. That'll go a long way in the mental health of your workforce. So really important that you're paying attention here. Just a few more minutes on slides and then we can open up for questions. Working in the home office, you may or may not have an opportunity to have some of your workers work from home. If you do, we do get a lot of questions on this. Your responsibilities as an employer apply if your workers are working at home as much as they do if they're working in your work location. So you need to ensure you have a policy in place for how people work at home, that a hazard assessment is being completed in the home workspace, procedures are in place, including ergonomics, which I'll show you in a moment, evacuation or emergency procedures, education and training, ensuring your workers understand those procedures, ensuring there's check-in procedures, particularly if they're working alone when they're at home, that you're checking in with them on a regular basis. Now, it doesn't mean you as the employer have to go out to their home and do the assessment face-to-face. You can potentially provide checklists. In fact, we've got some links here where you could provide some checklist information to them to do that hazard assessment, and then you do a check-in with them over the phone to go through that and talk about their workspace. And really what you're looking at, for the most part, the risk in the home environment, other than emergencies like fire or anything along those lines, really the risk here is musculoskeletal injuries, where the ergonomics of the workstation really come into play here. And I draw your attention to the link down at the bottom, which gets into, it's a resource we call How to Make Your Computer Workstation Fit You. Very easy to understand resource, excellent for you as the employer to go through, as well as your workers to go through and understand. It'll help them set up their computer workstation at home. The other thing I want to focus on here is the micro breaks. It's very easy to roll out of bed in the morning, stroll into your office, sit down in front of your computer and not come up for a breath until dinner time. That's not healthy, it's not safe. We really want you as the employers to be encouraging your staff to take micro breaks. We try and drive the 20-20-20 rule, which is every 20 minutes you take a 20-second stretch break by standing up and looking 20 feet away from your computer to relax your eyes and relax your muscles or stretch your muscles. So WorkSafeBC support, talked about a lot of information on our website. It can be overwhelming. This is a picture of our homepage. You'll notice the picture of the virus sitting down there in blue. If you just click on that, it takes you to our main pages. Lots of information on there. It can be overwhelming, but do the best you can to find something that aligns with your industry. And as I said, within the next few weeks, probably the first couple of weeks of June, we will have information on our website specific to tourism. So I encourage you to be revisiting our website on a regular basis. Now, if you've gone to our website, you've looked up information, you've done the best you can to develop your plan, and you're still running into issues, you can call us. And I draw your attention immediately to those phone numbers in the bottom right-hand corner. In the Lower Mainland, 604-276-3100. And outside of the Lower Mainland, our toll-free number, 1-888-621-SAFE or 621-7233. You can call us anytime. We are responding to those phone calls within about 30 seconds on average right now. And depending on your question, it takes on average about an hour and a half to provide a full response to your query. We are here to help you. We have 25 people on that line that are answering calls and providing support to employers every single day. So I encourage you to use these phone numbers if you need help. Now, again, don't send us your plan. Don't call and say, hey, I want to send you our plan so we can review it. We're not going to review your plan for you. We don't have the capacity for that, but we will answer specific questions you might have about your plan. So if you're struggling with a certain area or how to assess the risk or how to implement a control measure, give us a call and we will help you. We also have 300 officers that are out there engaging with employers. I have 25 people on my team that are out there doing that as well. We can't write orders on my team. We don't enforce the regulation. But between our 300 officers and my team of 25, we are out there calling employers and taking a consultative and educative approach to this, helping you, asking you if you're having any challenges, what those challenges might be, how you might be able to work through your risk assessment. Have you put control measures in place? Where are you struggling to determine how to put control measures in place? We really are taking a consultative approach. But I do have to say that there is a requirement based on the provincial order that you have a COVID plan in place and that you've posted that plan. So if you as an employer are really not paying attention to this, you haven't developed your plan, you're not in the midst of even developing your plan, and you're not really showing your due diligence, we will write you an order. And that order will fall under Section 21 of the Act, which used to be Section 115 of the Act, and that's general duties of the employer. And under those general duties, it's your responsibility to ensure that you are maintaining the health and safety of your workers. And this applies as any other risk does in the working environment. So you will be written an order if you are turning a blind eye to all of this and you are not developing your plan. Now, given that we've got 263 people on this line, I'm going to guess none of you are in that situation because you probably wouldn't be on the line with me right now if you were putting your effort into doing this. So I know none of you are in that situation, so you shouldn't expect to get any orders. We are really taking a consultative approach here to help you out. Claims, I'm not going to spend a lot of time here. We do have a claims FAQ document related to COVID claims. Essentially, it follows the same process. It's a pretty high test because your worker would have to be able to prove that claim, that exposure to the illness occurred within the workplace during the course of their duties. So we do follow the same process, but I also want to let you know that all of our claim services are still active. So if you have anyone out on claim right now, whether it's related to COVID or another injury, then full services are there and you can call us and we will provide the assistance that you need. A few other resources, of course, is the BC CDC, the Office of the Provincial Health Officer, HealthLink, the COVID symptom self-assessment tool on the BC Ministry of Health website. We've also got lots of industry resources. I have not really tailored this slide to each presentation I'm doing. You see some there, but I also want to point out Go2HR. Go2HR is an excellent resource for you, and I know they are doing an excellent job of supporting small employers in this province, or all employers in the tourism industry with the issues that they're having as you're moving forward. So I do encourage that you utilize Go2HR to be able to help you out as well. And so that brings me to the end. I know I went a little over time there, some technical difficulties up front, so my apologies. I put 2 email addresses on this final slide. The first one is mine. You're welcome to send me an email if you have any questions. We have our other general inbox, consultation services at WorkSafeBC.com. That's more so geared towards industry level. So if you're an association or you're looking for industry level protocol input, you can definitely send us an email there. My team typically works at the industry level. If you're an employer and you're looking for input, I do draw your attention back to the slide that had the phone number on it for our prevention information line, which again is in the bottom right-hand corner there. So hopefully that was helpful. Again, these slides will be sent out to you with all the active links. And Clint, maybe back over to you and I'll stop sharing my screen and maybe we can open it up for some questions.
Yeah, great. Thanks so much for that, Chris. Certainly lots of information to pack into 50 minutes. And I'm sure a lot of us are still trying to absorb it. So thanks for that. We certainly have some questions rolling in here, so I think we can just jump right into them. First one is in relation to the vehicle issue you brought up, and as you can appreciate, in the tourism industry, vehicles are for many of our operators, very important piece of the experience. And you mentioned doing the best to keep people distance. that type of thing. But will there be any more sort of formal guidelines we can use to ensure the safety of clients for those operators that use vehicles?
Yeah, thanks, Clint. I appreciate that. So keeping in mind that the protocols and the guidelines that we're putting up on our website are focused around worker safety, because that is our mandate. So of course, the public safety is obviously a big part of this as well, a little outside of our mandate. Having said that, though, I totally appreciate that every employer in that province would not be employed if they did not have the clients and the public utilizing those services. So when it comes to transportation of people, the general public, your clients within the workplace, the protocols we will put in place will be geared towards the workers and the safety for those workers. But some of the principles can absolutely be applied to your clients as well. So again, the vehicle is difficult, and I apply the same thing to a boat or a float plane or any other mode of transportation where you have people sitting closely together. If you've got families that are coming and utilizing your service, it's okay to have those families sitting close together because they live together. So that's all right. But you do want to try, if you can, to maintain as much physical distance as you can. Maybe it means you have 2 different vans driving out to the location instead of 1 in certain situations, if you're able to do that. Where you're not able to do that and you do need to pack your van full, we try and stay away from it, but you might want to have a policy in place that everyone in that van has to wear a mask, a non-medical mask, for the duration of the trip, if you can't maintain the 2 meters of distance. And particularly for your drivers, or possibly if you're out on a boat, if you're out on a tour boat, for example, doing a whale watching tour, and you've got your captain of the boat, but then you've also got your MC or your host, and typically your host would be walking up and down the boat, talking to people, getting close to people. You may want to change that approach, and it may not feel like the best customer service, but I think everyone understands the situation. You might want to have that host sitting right up at the front of the boat, possibly even with a bit of a plexiglass barrier in front of them if needed, or at least 2 meters apart from the first row, or maybe you don't fill up that first row, and really try and maintain some of that distance. And I think most people are going to be reasonable and understand the situation in that case. So hopefully that's helpful. With the tourism guidelines we'll put out, we will do our best to be able to dig into that more, but it's really going to depend on the situation.
Yeah, and I certainly know that our industry, we're all very anxious and eager to see the industry guidelines that we're talking about. The next few questions I think I'm going to kind of combine because they're somewhat related and probably building off of exactly what you just mentioned around face masks. So I'll just kind of read them as 3 here. Are cloth masks considered PPE by WorkSafeBC? Not all masks are created equal, and I've heard a lot of debate about types of masks. As long as some kind of facial protection is used, does that cover the requirements? And thirdly, if a part of the plan to protect employees is to ask visitors to wear masks, is it the employer's responsibility to provide those masks?
Yeah, really good questions, and I'll sort of try and take those actually one at a time. We do have regulations, and we have regulations in place around PPE, personal protective equipment, and it is mostly geared towards certain industries and obviously varying levels of PPE. So let's use healthcare as an example. Healthcare is an industry right now where there is a requirement for not necessarily everyone, but a lot of healthcare workers to be wearing proper PPE, and we refer to N95 masks. A lot of you have probably heard of N95s and the shortage of N95s and all that sort of stuff. Those, if properly fit tested, then that can provide a very high level of protection. And the 95 actually comes from 95%. So it's not even 100% protection. It is 95%. We'll keep 95% of the droplets out. So that's something that needs to be considered there. But when we get into industries like yours, there really is not a requirement for you to be providing PPE to your staff. And I'm referring to masks here. So when you talk about, is a cloth mask considered PPE? In our respect from WorkSafeBC, no, it's not. But it can provide a certain level of protection related to COVID. So we actually have a guidance document on our website that is specifically geared towards masks. It's actually sort of a poster type document that gives you an outline of how masks work and what level of protection they're going to provide. And as I said earlier, if everyone is wearing a mask, if you are wearing a mask, you are protecting other people, you're not protecting yourself. So if everyone's wearing a mask, you're providing a level of protection for the whole group. But if there's one or two people in there that aren't wearing a mask, then there's a potential for exposure from those one or two people. So when you think about the policies you're putting in place, if you have a policy in place that your workers have to wear masks in certain situations, and again, we're really trying to recommend that those situations are only when they have to come in within 2 meters of each other, that they should consider those masks. Then if you have a policy in place, yes, you likely have a requirement there to provide those masks to your workers. When we talk about the general public, if you have a policy in place, that's up to you on whether or not you want to provide them. There's nothing under our act or our regulation that states that you would have to provide those masks to the public or to your clients. But if you have a policy in place saying that clients have to wear masks when they're sitting on the boat, then you can deny them that service if they're not going to comply with your policy. Now, some people do have certain issues like claustrophobia, or they might have a certain reason why they can't wear a mask. You may need to look at accommodating that person in a different way. You might have to, in that case, have them sit in a certain location and ensure that they are 2 meters from everyone else. So you might have to accommodate. We're kind of thinking the 80-20 rule here. There may be certain situations where you do need to change that. I think I covered most of that question, but if there's anything else, let me know. The other thing I should mention too, Clint, is I know we're coming up on 2 o'clock. I'm happy to stay later. If people want to stay later, I'll leave that up to you. But I do have some time after 2 if you want to keep going.
Okay, thanks for that. Yeah, there certainly are a few more questions here too that I think we need to kind of get through here. The next one, again, there's a few questions in relation to particular sectors within our industry. This one primarily fishing related. So again, a sort of a combination of questions here. First, is there a protocol developed for fishing charters on small commercial vessels, and when will that be available? And the second piece is kind of answering that, given the guidelines for the tourism sector have not been posted yet and not scheduled until early June, can we assume that if we have a COVID plan in place, we can operate, specifically speaking to the sport fishing and guiding industry? I'm just not sure if they fit into phase 2 or phase 3.
Yeah, good questions. Good questions. So, actually, I'm going to address that last question first, because what's really important to understand is if you were not mandated to close down, then you can be operating as of today. So whether you fall into phase 2 or phase 3 is somewhat irrelevant in that situation. Now, if you were running a nail salon, or actually let's use restaurants as an example. If you were running a restaurant out of your facility, then you know that there was an order put in place in March that you could not have seated patrons within your restaurant. You could only do takeout. That order has now been lifted as of May 19th. So you can now have seated patrons, and there's a new order that speaks to restaurants. So if you have an order, and that's why I said earlier, you really need to go to the Provincial Health Office website and see whether or not there are orders in place for your particular operations. And if there are, you need to comply with those. Otherwise, you don't have to wait for our guidelines and our protocols to put your plan in place. You can call us. We'll help you as best as we can if you're running into any challenges. But because the government essentially sort of, I'll say, categorized tourism, hotels and resorts and all that sort of stuff within phase 3, we had to prioritize how we were developing our protocols. So we're getting to it. We're working on it actively right now. My team is working on the protocols, but it'll likely be a few weeks before we have it up. Now that brings me to how that's going to be categorized. We're getting lots of, we engage very closely with all the associations in tourism, or many of them, and we've engaged with associations around sport fishing, around adventure tourism like mountain biking and rock climbing, various other associations that we work very closely with. And the idea is that we will do our best to categorize our protocols into different groupings. Whether or not there'll be protocols specific for chartered fishing. I can't tell you right now because we haven't finalized it, but that is our thought process we're going through on how do we best categorize the information so it's useful and user friendly to you as an industry. So we are doing the best we can there.
That's great. Thanks for that. Another one here. Is there a formula for finding out how many people per square foot are allowed in a room or an open area?
Yes. Yes, and there's a caveat to it. So the general idea is, and the BCCDC actually posted this on their website fairly early on for grocery stores, and we have an occupancy calculation that you can link to on our website. It's actually within the COVID safety plan. If you look at it, it'll show you how to do an occupancy calculation. And essentially what it looks at is about it looks at 5 square meters or recommends 5 square meters of unencumbered space per person. Now, unencumbered space means you can't just take the square footage of your facility and divide by 5. You need to be able to, if you've got displays up and tables and things like that around, that's not unencumbered space. So you need to look at 5 square meters of unencumbered space per person to give you a rough idea of that calculation. The only caveat to that is with restaurants. And if you read the order that was posted on Saturday of last week, there is, within that order, there is a piece for all restaurant and food services facilities. They have a capacity limit of 50%. So even if, say you had seating for 400 people within your restaurant, even if you were able to maintain 5 square meters of unencumbered space for 350 people, you wouldn't be able to. You can only have 200 people in that situation because based on the provincial health order, you are only allowed 50% capacity. So other than restaurants, that occupancy calculation should work for most employers, but for restaurants, there is a bit of a caveat there.
Okay, thank you. Another one here. If we have a business with different types of departments, do we need one overall plan or one for each department? For example, we are a winery with production facilities, vineyards, a restaurant, an inn, and a wine shop / tasting room. Do we need 5 different plans? Agriculture, hospitality, manufacturing, etc.
No. I mean, that's really up to you on how you wanna organize that plan. But the employer is required to have that plan in place. And really the way we look at it and the way the officers will look at it if they come out and ask you about your plan is really around that risk assessment. So have you addressed all the various areas of your operation and done that risk assessment and come up with your plan? But no, you would not be required to have 5 different plans if you have 5 different types of operations going on.
Okay, and just a bit of a follow-up to that and risk assessment. Do you recommend using COVID risk assessment questions before allowing visitors into an arts or cultural space, or really any space for that matter?
Yeah, we do recommend that at least up front, you're asking those people coming into your workplace whether or not they're experiencing any signs or symptoms, and that you do have policies in place that will deny access. That can be tricky. We know it can be tricky for your business, but I guess the flip side of that is if you are putting those policies in place, you're actually creating confidence for other members of the public that are going to come in and use your space. So yes, you may deny access for the odd person because they're showing signs or symptoms, but you're actually creating more confidence, and hopefully, that fear that the public has of coming back and using restaurants and going into retail and things like that, that'll go a long ways to help. So, whether it's someone standing at the door and going through a questionnaire as people come in through the door, that's kind of up to you. I know with personal services like hair salons, we've recommended that there's a quick phone call out to them, the day before or the morning of, to say, hey, are you experiencing signs and symptoms today? If so, we'd like to reschedule your appointment to 2 or 3 weeks from now, that type of thing. So we do really recommend that you have some sort of engagement with your clients so that you are avoiding any potential exposure of sick people coming into your workplace.
Okay, thanks. Maybe we'll just do a couple more and then we'll wrap it up. Can we use cloth towels in the bathroom that we wash after each use, or do we have to use disposable cloths?
So yeah, another really good question. There's been a lot of been a lot of debate, I'll say, over how long the virus can live on surfaces. You know, we get questions a lot from the retail industry about, you know, if someone tries on a sweater in a store, do we need to quarantine that sweater for 2 days before we put it back out on the rack? And really, we're not recommending that that is necessary, because a lot of times when the virus gets onto a surface, it doesn't necessarily transfer to that surface in its complete form. So it's partial bits of virus, it's not a lot of virus, and you actually need hundreds, if not thousands, of virus cells in your body to create that sickness. One virus cell getting into your body is not going to make you sick. You need a lot of it. And so we're trying to focus employers on cleaning the high surface touches, like the light switches or the countertops or the desks or the door handles and things like that. But with a cloth towel in a bathroom, again, you want to make sure you have policies in place that they're washing their hands. But if they're washing their hands with soap or water and then drying their hands on that towel, if they've washed their hands appropriately, there should be no virus getting onto that towel. So, you know, that's kind of up to you on how you want to do that. The other thing we're recommending with washrooms is that you do have hand sanitizer outside of the door, if possible, so that as your patrons or your workers are going in and out of the bathroom, they're able to use some hand sanitizer before they go in, and then use a little bit of hand sanitizer when they come out. So that's one recommendation to also help the situation and keep people's hands clean, and hopefully avoid any spreading of the virus through washrooms.
I'm just wondering, the next one is in more in relation to staff and workers. And I know you mentioned a couple of things around that particular piece, but what if a worker is unreasonable and no remedy is sort of good enough for them, or safety protocol? Do you have any recommendations around that?
Well, I think that comes back to a few things that I mentioned throughout the PowerPoint. I think one is you know, every worker has a right to refuse. As I said, there's a process to that, and if you are unable to come to resolution, you can call these numbers that I provided to you, and we will put an action. We call it an action request. We'll put an action request in place, and an officer will come out to your workplace and help you to resolve that issue. So that is one route to go here. But the other thing is that sometimes it's not necessarily related to a refusal of unsafe work. Sometimes it's related to the fact that you put a policy in place where certain tasks require your staff to wear masks, and your staff are saying, no, I don't want to wear a mask. Now, if they have some medical reason why they can't wear a mask, whether it's claustrophobia or some other reason they can't wear it, then you do need to look at accommodation. But if it's just that they don't want to wear it because they are being difficult and they don't want to wear it, you have a policy in place, and that really gets more into the HR side of things as opposed to our mandate, and that's going to be dependent on how you as the employer want to handle that situation.
Yeah, certainly. Okay. Thanks for that. There are more questions here for sure, but I think with that, we're already 8 minutes after the scheduled time, so I think we'll wrap it up, Chris, and certainly some great information, like I mentioned, provided here today on this highly important topic, and certainly we appreciate you taking the time to present today. And it sounds like lots of great tools on the WorkSafeBC website to support the industry. Certainly looking forward to those sector-based guidelines as we move forward. So thank you for that. Also, just wanted to briefly share that the next Tourism Resiliency Program webinar will take place on Wednesday, May 27th at 10 a.m. PST, and will cover best practices for using social media during the COVID-19 crisis and beyond. And we're very excited that we'll be welcoming in Amrita Gurney, the Vice President of Marketing and Community at Crowdrift, so a great tool that we all know and use. And you can register on the tourismresiliency.ca website, or stay tuned to communications from your local regional destination management organization. So with that, I think we'll sign off. And as I mentioned, this has been recorded. Visit tourismresiliency.ca. Should be up by Monday, I'm told, if you want to take another look at this particular webinar. I just want to again thank Chris, and thank you all for participating today. Have a good afternoon.